For this video, I'm going to focus on answer number 12, specifically the biochemical testing that is used in assessment of high-risk pregnancies. This information is found mainly in chapter 26 of our book. So first I want to talk about prenatal screening tests, and these help identify pregnancies that are at risk for certain chromosomal abnormalities. We want to point out that these tests are mainly for screening and not diagnostic. These include the triple quad screen, the MSAFP, and cell-free DNA screening. Now these tests will help screen for chromosomal abnormalities such as Down syndrome, neural tube defects, and isolates fetal DNA fragments from maternal blood to determine all the things listed in that second column for cell-free DNA. For the triple quad and MSAFP, ideally get these tests done during 16 to 18 weeks, and for cell-free DNA, it is offered starting at 10 to 20 weeks. We want to make sure that we inform the patient of the benefits and limitations of these screenings, recommendation for further diagnostic testing using invasive techniques before the patient takes these results and decides to do something that they can't take back, such as an abortion or termination of a pregnancy, and stress that these are screening tests. Now from there we would move on to diagnostic tests, and that is the CVS, amniocentesis, the LS ratio with positive PG, and the PUBS. And these will help confirm some of those pre-screened or those screening tests. And we can see that they begin around 10 to 13 weeks, 14 weeks, and the LS ratio coincides with when the amniocentesis is done, and the PUBS can be done during the second or third trimester. Now, if these results show positive, then it is used as a diagnostic of a chromosomal abnormality or some other hemolytic disease, and from there the patient would be offered genetic counseling. We'd monitor for complications of this invasive procedure, and if the mother is Rh negative, we would also administer RhoGram, even though there's a slight, very rare possibility of the blood mixing. It's still possible. And with the PUBS, we would also continue to monitor the patient 1 to 2 hours after the procedure and have the patient count fetal movements at home. And last but not least, another prenatal test we want to talk about is the glucose tolerance test, and this is to help diagnose gestational diabetes. Now we want to note that the 1 hour glucose test is the initial test, and if that shows positive, then you could either repeat that or do a 3 hour glucose test, but we must have 2 elevated readings for diagnostic. Now, if a patient has a risk factor for gestational diabetes, they would get this at the initial visit, but if for anyone else who isn't at risk, they would get it done during 24 weeks.